Dr. Therian here, and if you're watching this video, we likely just talked about an episcleritis during your eye exam. Now, understand this video is just to reinforce what we talked about during that exam, and it doesn't replace the need for eye exams or anything along those lines. So what's happened is we've got a little pocket of inflammation. It's on, just a little section of one of the eyes or maybe even both of the eyes, and it's just causing some redness, a little bit of irritation, maybe some watering, that kind of thing, and it's just irritating you. Basically, the body has decided to put inflammation there on the eye, and we don't really know why. It just kind of decided to do it. Reoccurrent ones, it happening over and over again, is actually fairly common. And so don't think that if this happens multiple times, it has to be something that's going on. But it can sometimes be something that's going on. And so what we do to monitor it is we just check on the frequency of it, how often it's happening, and to what degree and what level it is. Because some really bad ones can need some major intervention, and some really mild ones are just maybe some artificial tears, some eye drops will get it fixed up and nothing to worry about. And so what I'm looking at is, how big and inflamed is the area? Does it even have a nodule, a little pocket of white blood cells that are just sitting there, immune cells that are just hanging out, saying, hey, here's all this inflammation, we're trying to find something to attack, but we can't find anything. When I see those types of things, then I usually increase the treatment protocols. And so treatment for these things is, sometimes artificial tears only if it's really mild, can get to where we're using steroid eye drops if it's a little more severe, and then can get to where we're talking about taking like oral NSAIDs like ibuprofen, that kind of thing. Now some docs will skip the topical and go straight to the oral, some will do both at the same time. There's a lot of variation on how to treat this perfectly. But things to watch out for. Anytime we're using a steroid, we want to make sure that we're not getting worse, right? Because if it's a bacterial infection and we're using a steroid, and the steroid can allow that bacteria to kind of grow a little bit quicker. And so pay attention to, is it getting worse? Is it getting better? But it'll take a couple of weeks of treatment to get this thing fixed up typically. And then we just keep an eye on it to see if it happens again. And if it's happening over and over again, every 3 or 4 months, we may consider talking about doing some blood work to look for, lupus, Sjogren's, arthritis, ankylosing spondylitis, some autoimmune disease that just says, hey, my body's flaring up and kicking extra inflammation around. But for the most part, typically when I see these things in clinic, they're fairly benign, nothing to worry about. I put you on a little topical steroid and it typically gets fixed up pretty daggone quick. Obviously this video doesn't replace the need for an eye exam or for proper medical intervention in these situations. But if you have any questions, you can always reach out to us. We're here.